everybody, welcome back for another episode of Physio Show. Today, we're tackling a common question that I get in the clinic all the time. Do I need a cortisone injection? While it may seem simple, the answer isn't always straightforward. It depends on the specific condition. And this is because cortisone shots can offer rapid relief and speed up recovery for some issues. But for others, they might actually worsen the problem and lead to long-term complications. So in this episode, I'll be breaking down everything you need to know about cortisone injections. We'll cover exactly what they are, when they may be beneficial, and when you might need to consider other options. Cortisone injections are a type of steroid that helps control inflammation. They are most commonly applied directly to joints such as the shoulder, hip, or knee, or into tendons or the bursa. The primary goal of these injections is to reduce inflammation and can lead to a significant improvement in pain and stiffness, allowing for quicker recovery. Cortisone is a type of corticosteroid, a class of drugs that mimic the effects of cortisol, a hormone naturally produced by the adrenal glands. Cortisol plays an important role in the body's stress response and helps to regulate inflammation. When delivered through injection, cortisone targets inflammation at the local level by suppressing the activity of the inflammatory cells and chemicals that contribute to swelling and pain. By reducing the inflammatory response, cortisone injections provide rapid relief. However, it's important to understand that while cortisone reduces inflammation, it does not heal tissues or address the underlying cause of the problem. Cortisone injections are particularly effective for conditions where inflammation is the major issue. This includes pathological inflammatory conditions like frozen shoulder, carpal tunnel syndrome, trigger finger, bursitis, and mild to moderate arthritis. It works by reducing swelling in the area, leading to reduced pain and smoother movement. But remember, cortisone injections do not heal tissues or address the underlying cause of inflammation. Instead, they offer short-term relief, creating a valuable window of opportunity to engage in strength training and other therapeutic exercises. By combining cortisone injections with structured rehab programs, research shows individuals can achieve more significant and long-lasting improvements in these conditions. Research has shown that while cortisone injections may be beneficial in certain conditions, they may not always be the best choice and can even worsen symptoms in other cases. This is especially true in tendon injuries such as tennis elbow, golfer's elbow, and rotator cuff tendinopathy. And the effectiveness and impact of cortisone injections largely depends on whether the tendon injury is acute or chronic. For acute tendon injuries, cortisone injections can provide significant short-term relief. These injections work well in cases where the primary issue is inflammation, resulting from a recent injury, and the tendon has yet to undergo significant degenerative changes. By reducing pain and swelling, cortisone can make it easier for patients to engage in rehab exercises, which is crucial for healing and preventing the injury from becoming chronic. In such situations, cortisone injections can be beneficial and might not negatively affect the healing process. And despite research indicating that cortisone injections can provide temporary relief, typically lasting between 6 to 12 weeks, research also shows it potentially worsens long-term outcomes. Cortisone can weaken the tendon structure by interfering with the body's natural healing processes, essential for tendon repair and regeneration. If the pain is not severe and can be effectively managed with oral medications, ice, and rest, I suggest avoiding cortisone injections altogether due to their potential side effects on soft tissue healing. In contrast, chronic tendon injuries are characterized by long-term degenerative changes rather than active inflammation. Chronic tendon issues involve the gradual breakdown of collagen fibers in the tendon, leading to a loss of strength and elasticity. In these cases, cortisone injections offer minimal benefit because they do not address the underlying degenerative changes. Making things worse, cortisone can weaken the tendon further by suppressing the natural healing process and reducing new collagen production. Over time, this can make the tendon more fragile, increasing the risk of further injury and long-term degeneration. While cortisone injections target inflammation by suppressing inflammatory cells and chemicals, this approach is less effective for chronic injuries, where the primary issue is degenerative changes in the tendon's tissue. This leads to further deterioration and an increased risk of symptom recurrence. Studies have shown that patients receiving cortisone injections for tendon issues often experience a higher likelihood of recurring symptoms within a year due to the reduced resilience of the tendon tissue. Consequently, the potential long-term harm of cortisone injections may outweigh their short-term benefits for managing chronic tendon pain. The accumulation of damaged collagen disrupts the tendon structure and its ability to heal and repair itself. So while yes, it's true that cortisone injections can offer significant short-term relief for inflammation-related conditions by reducing pain and swelling, they do not address the underlying causes of pain or heal damaged tissues. This is where physical therapy becomes crucial. A structured physical therapy program complements cortisone injections by focusing on restoring strength, flexibility, and function. It addresses specific mechanical issues such as muscle imbalances and poor posture, helps prevent recurring symptoms, and enhances overall mobility. By correcting these imbalances, physical therapy helps alleviate stress on the affected joints and tissues, reducing likelihood of recurring pain. Cortisone injections are a useful tool for addressing orthopedic injuries, but they are not a cure-all and come with potential downsides. For primarily inflammatory conditions, they can provide a temporary relief that allows for effective strength training and long-term success. But for soft tissue injuries and tendinopathies, cortisone injections are less likely to offer lasting benefits and may pose risk to integrity of the structures over time and should be used with caution. Well, I hope you enjoyed this episode of Physio Show. Make sure to hit that like button and subscribe to the channel so that you can stay up to date on everything you need to know about your body, how it works, and what it needs to keep moving.